Woman breaks out in web-like purple rash after cold weather in New York. Freezing temperatures in New York caused a woman to develop an extensive purple marbled rash all over her body. The 70-year-old was suffering from a rare disease, symptoms of which were triggered by a cold spell where temperatures fell to -9 degrees Celsius. The woman arrived at an outpatient clinic in New York, having experienced dizziness and a rash for the past week. 2 weeks prior to this, she had a viral respiratory tract infection, a case report published in NEJM notes. On physical examination, she has a generalized macular non-blanching rash in a reticular pattern with purplish discolorization consistent with livedo reticularis, the report said. A non-blanching rash is where the rash does not fade when pressed with a glass. Livedo reticularis, according to the Mayo Clinic, is a condition that causes the skin to appear mottled and purple in a net-like pattern. It's thought to be related to spasms of the blood vessels or circulation problems. Doctors treating the woman tested her blood and diagnosed cold agglutinin disease. The initial samples showed the blood had clumped. After warming it in a saline bath, it returned to normal consistency. Cold agglutinin disease is a rare form of autoimmune hemolytic anemia, meaning the body's own immune system starts to act on its own red blood cells membranes. Kanika Sharma and Anush Patel from the Bassett Medical Center in New York told Newsweek in an email. Both Sharma and Patel worked on the woman's case. Agglutination, she explained, is where red blood cells clump together, preventing the free flow of red cells. It's called cold because when patients are exposed to cold environments, symptoms get triggered, which causes red cell agglutination, Sharma and Patel said. It's a rare disease affecting around 1 person in a million and affects around 15% of people with autoimmune hemolytic anemia. The team say her condition was likely exacerbated by the viral infection the woman had suffered with and the cold weather in upstate New York at the time. The woman was warmed and given blood transfusions along with rituximab, a drug that targets the immune system. The patient we described as a severe exacerbation based on profound anemia, Sharma and Patel said. She had symptoms because of anemia. We had to give her multiple transfusions of warm blood. She was discharged after her dizziness had lessened. The rash, however, persisted. Usually the rash is seen in a localized area. Unlike Our Lady, who had an extensive rash all over her body, this extensive rash was due to the fact that all the blood vessels in her body were under low oxygen tension due to exposure to cold causing agglutination. Her rash slightly improved with warm environment, but as we live in the extreme north where winters are harsh, the rash didn't go away completely. She was placed on rituximab. Usually medical treatment takes 2 to 4 weeks to suppress the immune activation. During that time, we continue supportive treatments like blood transfusions and keeping warm.